Hi, welcome to Cancer Prevention and Cure, what you yourself can do, the short version. My name is Peter Strauss and I've been researching diet and health for 3.5 years now. The last 2.5 wasn't cancer only. There are 3 types of carcinogens: the ones that stimulate DNA damage to occur, the ones that suppress the immune system, and the ones that stimulate cancer growth. Effectively, cancer as a disease is a battle between our immune system and this wild growth called cancer. We will have a look next at what you can do yourself, which is both helping the immune system and suppressing growth. In order to fight cancer, the immune system has T cells or killer cells and also apoptosis at its disposal. If appropriate, our oncologist might recommend a type of immunotherapy for the cancer patient in order to help the immune system. We can also stimulate the immune system through healthy nutrition, exercise, and a healthy mind. All of those have been associated with better outcomes for cancer patients. We can also make sure that we do not ingest anything that stimulates the cancer growth. The most common ones are about 40 to 50 growth factors and growth hormones coming from the animal food we eat. There are also some in medication. We humans have about 60 different hormones doing lots of functions in our bodies. The mammals we consume often have the same hormones. Sometimes there might be slight different versions. Some of these hormones promote growth, like estrogen, progesterone, prolactin, testosterone, and somatropin. To top it off, there are about 40 different growth factors as well. These are other proteins promoting growth. From here onwards, I will use the term growth factors to indicate both growth-promoting hormones and growth factors. From a health perspective, we humans are simply plant eaters, which we can see from other affluent diseases like heart disease and diabetes. We make all the growth factors we need ourselves and do not need any more. Some people argue that the growth factors do not get past our digestive system. Well, we notice that similar hormones in medication get past our digestive system. These are oral medications like the contraceptive pill, the abortion pill, and hormone replacement therapy. From research, it would strongly appear that at least some of these growth factors get into our digestive system, upsetting the natural balance. The World Health Organization has labeled one of these growth hormones, estrogen, as a class 1 human carcinogen. This means it is definitely carcinogenic to humans. There is no known pathway of estrogen causing DNA damage. However, it is known for its growth-promoting properties. Hence, it falls into the group of carcinogens that stimulate cancer growth. There is research out there linking modern dairy to estrogen levels that are 33 times the natural ones. That is enormous. Here is a list of factors other than cancer that are also stimulated through the extra hormones we get from consuming animals. People grow taller nowadays, women grow bigger breasts, menopause comes later. In many affluent countries, menarche, the first menstruation, has been coming down by about 5 years over the last 150. Hot flushes, endometriosis, morning sickness, infertility problems, and PMT. Quite a few of these have been associated in observations with both higher cancer rates and the consumption of more animal food. I did my own cancer research and found a 7-fold difference in cancer rates between those countries consuming a lot of animal food and those that ate little. A 7-fold difference would mean that about 85% of cancers can be avoided through diet alone. And yes, I also looked at other possible causes of our high cancer rates, but no, I did not find any strong associations at all with these factors. For more details, see the long version of this presentation. What makes cancer research so difficult? What is different about this study compared to the many other cancer studies out there? Well, epidemiology is inherently done in a noisy environment. In controlled experiments, we can control all other factors that might influence the outcome, but in epidemiology that is not possible, as we study people in their normal lives. These other factors influencing our epidemiological measurements appear as noise in our area of interest, the cancer. For instance, if you want to study the influence of milk on cancers in populations, you will also possibly get influences coming from smoking, alcohol, meat consumption, the type of milk consumed, and other more processed dairy products, for instance. If we look at the animal's growth factors as a possible carcinogen, then we are dealing with a noisy source. There is quite a few different sources of these growth factors. On top of this, their effects are modulated again by other factors. Hence, about 200 different types of cancer are possibly modulated by about 40 to 50 different growth factors. Different cancers will respond to different growth factors differently. Finding associations in these circumstances is not a simple task. Let's have a closer look at the growth factors. Growth factor ingestion varies with the consumption of meat, dairy, eggs, fish, seafood, and medication. Growth factors could well be modulated by farming practices, what the animals eat, the animal medication, selective breeding like selecting for growth and selecting for milk yield, and the animal's age when consumed. The cancers possibly resulting from the growth factors are also noisy because of many concurrent other carcinogens adding to the picture. Here is a list of 16 out of 27 cancers from the World Health Organization's website listed on top of the slide that have a positive link with the animal food consumption. Behind brackets are other carcinogens that have also been associated with these cancers. Hence, smoking, alcohol, human papillomavirus, UV, and other factors will modulate our measurements. They will make our measurements noisy. In order to get a clearer picture, we need to reduce the noise through combining the major growth factor sources and modulators, which reduces intermodulation and improves the signal-to-noise ratio, and also combining the cancers linked to the animal diet, which also improves the signal-to-noise ratio. In good research, we need to maximize contrast. We need to look for geographical differences and differences over time. We need to maximize data. We need big geographical areas and big populations. We need to maximize viewpoints and see if we get the same results from all aspects. In other words, we need the Bradford-Hill criteria. What about other research? Apart from the complexities of cancer research just discussed, we are a capitalist society with capital as a central focus, and not really health. Capitalist societies work hard and are very efficient, but do not necessarily do the job that counts. Because of the capital influence on research, the outcomes are mainly turnover and profits. Turnover, unfortunately, means more disease for the population. Pure research is fueled by idealism and has minimal financial associations. That is why independent research is so important. A lot of the Australian so-called not-for-profit organisations collecting money are mainly sponsored by the industry and often appear to be working for the industry. Our own national research institutions like the CSIRO and universities have had severe cuts over time and have needed to seek industry sponsorship. With this has come an industry bias, unfortunately. Truly independent research is hard to come by. Our governments, with their industry-sponsored election coffers, appear to have sold our soul to the devil. A low-fat, whole plant-based, starchy diet plus a B12 supplement does not stimulate cancer growth and does support a cancer remission. It is also the healthiest we can eat from the perspectives of other diseases, but this is not in the interest of the meat industry, the dairy industry, fisheries, the egg industry, processed food industry, the health industry, and the pharmaceutical industry. Altogether, that force is many times bigger than all the corruptive forces on our health we ever had coming from the tobacco industry. As pointed out, the industries are often allowed to sponsor our political parties. Their influences go everywhere. They really like influencing our culture and influencing the masses. The profit motive has a strong and definite corruptive side to it, which we've already seen clearly from the tobacco industry. While people in the West smoke less, the tobacco industry has increased their third world exports in order to compensate. After all, you cannot get profits get in the way of health. That is not in the shareholders' interests. And what else is important? Currently, the cancer industry is happy to fight cancer by suppressing it and by stimulating the immune system, but through drugs alone. However, it does not remove cancer growth stimulation. The cancer industry is trapped in the belief coming from our omnivorous behavior. It believes that we would be omnivorous from a health perspective as well, but that is incorrect. Healthy people would actually undermine the interests of a lot of industries, as we saw before. It is interesting to see what the cancer industry does with the relationship between tamoxifen and estrogen. Tamoxifen is a drug that counteracts estrogen. Estrogen plays a major role in multiple cancers, including breast cancer. The World Health Organization has labeled estrogen as a Class 1 human carcinogen, as we saw earlier. Tamoxifen is carcinogenous itself, according to the American Cancer Association. Research has found estrogen levels to be up 33 times in modern dairy. This is because of our modern dairy farming practices. So our oncologist gives us a known carcinogen called tamoxifen to lower the effects of another carcinogen called estrogen. What is strange is that he does not tell us at the same time that we should be avoiding dairy, as this opposes the lower estrogen levels he is trying to achieve. If estrogen is a problem, why not stop extra estrogen getting into the body? This is mopping with the faucet open. From my own research, I believe that about 85% of the affluent cancers are attributable to our food, and I also believe that modern dairy is the most carcinogenic food commonly consumed. The cancer warning label on dairy products should be bigger than the cancer warning label on cigarettes. More details, further analysis, and also references can be found here. There is some fantastic evidence supporting that a pure plant-based diet can be of significant benefit to fighting cancers. Wishing you all the best for your health. Peter.